As Ugandans continue to nurse the financial and emotional scars, particularly for the second wave of COVID-19 pandemic, health experts have predicted a third wave, which they say could be worse.
Projections from our scientists show that the third wave of the pandemic is likely to peak at 4,000 laboratory-confirmed cases per day. This is over 2 times higher than the second wave. This means that 15% of the patients will require admission at the health facility, and about 9,331 patients may require high dependency units or intensive care unit admissions.
Our visit to selected regional referral hospitals that include Masaka and Mbarara shows that the Ministry of Health is rethinking the management and the treatment of COVID-19, given lessons learned from the second wave.
Mbarara is one of those hospitals gazetted to handle and treat COVID-19 in this Southwestern region, and we have done so. So even when we are talking of the third wave that people are talking about, we are ready because, first of all, this hospital is happy that we constructed even an extra COVID unit that will be housing about 60 more very, very sick patients. That is in addition to the 40 that we already have. So if we can be able to have 100 beds, that would be like we are very, very prepared. Secondly, the Ministry of Health, through the Permanent Secretary, they've sent over 50 health workers here in this hospital, including 7 doctors, to manage COVID. Therefore, that is also a very good step.
Another critical issue that is being looked at keenly is the production of medical oxygen that became scarce, especially during the second wave, as health facilities choked on critically ill COVID-19 patients.
Produce oxygen. One of them is directed to some of these areas like COVID-19 unit, but also ICUs in the area. Then we have another plant which is like a buffer for the other one. So, but we also have over 100 cylinders, at least 120, which we keep filling in case there is a problem with the plant. We have a backup for cylinder oxygen, which is in cylinders. Now, when you look at that, it's like, yes, we have the plants are working, oxygen plants, but also we get more oxygen. We have been getting it from town here at Mwebesa factory. In case that has a problem, we get oxygen from Kampala, but that is in addition to the plants we have. I'm also being told that the new COVID unit which we have constructed, the ministry is going to give us another plant so that they become 3.
So we've commissioned the construction of another oxygen plant. So the structure for the plant, the construction works are beginning, and around the 15th of October, we shall be receiving another oxygen plant bought for us by UNICEF, and I think it will be installed around the first week of November. So by the second week of November, we shall be having a plant which has a capacity which is double the one that we've been having. So if you are to go with the 30 cylinders that we've been producing, we shall be adding another 60 cylinders, which will be 90 every day.
Some of the patients testify that the reason for their being severely affected by COVID-19 was the delay in seeking appropriate treatment.
Naye mukujja nasooka kubeerako waka nga nfuna ku bujjanjabi. Ne badokita baali banzijanjaba mu butuufu baali tebamanyi kiki kye bajjanjaba. Kuba bajjanjaba ne bajjanjaba oluvannyuma lwa wiiki emu nagenda okuwulira nga si kyassa.
Obulwadde buno buluma kubanga si bulwalangako lusoose naye bukwata buli buba busanze ndoza damage. Banze ntandika basooka mutwe lusujja omuliro nempulira emimiro gino nitaka okukozesa ku ddagala kakati netaka okwekuba mu lubuto naye yagenda okubanga asuuse ate amawuggwe ne geekwata kati bunaku bali ku mawuggwe.
Some of these patients were among those who disputed the existence of COVID-19.
Abantu abasinga mu nnyendo baali bawakana nga nange mwendi nga tuwakana nti COVID taliiyo naye mu butuufu abasawo be nali neesiga banzijanjaba mpaka we baalemererwa.
Mbarara Regional Referral Hospital handled 1,413 COVID-19 patients in both the first and second wave, admitted 661, discharged 423, and recorded 160 deaths in the second wave as compared to 46 in the first wave. By press time, Mbarara Regional Referral Hospital had 4 COVID-19 patients still on admission and 13 on home-based care, while Masaka had 5 patients.
Our status as per now, we have 5 patients who are inside. We have one who is in severe shape, then the other ones are in moderate form. So as per now, we are trying to battle our last patients here. But still, there is COVID in the communities because we have patients who are in home-based care as I talk right now. These are patients we are monitoring from home and they are still having COVID. So I think COVID is still there. So what we need to do is let us continue putting on our mask. People who are not yet vaccinated, they should go and vaccinate, especially the people who are at high risk.
As of 30th September 2021, the country had 115 new COVID-19 cases with a positivity rate of 2.8% with no new registered deaths. Diana Kute, UBC.